Kahit yung mga tao nagdududa sa Diyos, walang ibang choice kung hindi tumawag sa Diyos. Yun yung nasa isip ko. Diyos lamang yung makakatulong sa amin. Papasalamat ako sa Diyos na pinagkalooban kami ng ganung pananampalataya.
Our lobby, and this is the pharmacy and the emergency room. All the roof were destroyed. It's now replaced by a blue sheet. Roof is gone. Even after the typhoon, we were able to do suturing here because the emergency room was destroyed.
The big problem that we have right now is the mobility. We don't have vehicle, or our my vehicles are swept away during the typhoon. And what we are doing right now is just walking through the different barangays, giving immunizations, maternal and newborn cares, of course monitoring of the food and waterborne diseases. We really don't have enough vaccines, and of course the medicines that we are waiting.
How big is your area that you need a vehicle for?
We have 138 barangays in the city, and just imagine we don't have vehicle.
So what are you doing now? Tricycle and walk?
Sometimes we just walk. As you can see, we really have very human power. Almost all of our personnel were affected. 100% were affected. The devastation was so big, and our mobility is really hampered.
Our local team here of WSF will also help out in the surgical procedures and medical. We have a medical team that's ready to go to these areas anytime. Of course, most of the funding will come from the international counterpart of WSF, but we also have our own sponsors here.
What do you need now after this devastation?
As of now, our priority is the roofing of the hospital because it was destroyed around 90%. All our equipment were destroyed also by the rain. And of course, the ambulance, transportation of patients, and all the supplies, because our stock room, the central supply room, was destroyed.
Okay, how much would the roof cost, more or less now?
According to the Department of Public Works and Highways, it's more or less 7 million.
Wow, that's
but any amount would do.
Yes. How about the equipment? In terms of equipment, how much was damaged?
Damage was
30%?
Almost, no, it's around, we have a 30 million worth of equipment donated to us by the Department of Health. But for now, it's all destroyed.
All gone? 30 million?
Yes, Dr. Sontay told me that they are donating 2 ambulance.
Wow.
So I was so happy that I got out from the meeting and then talked to Dr. Algar. And I feel so sad, depressed, because from what I saw, I feel as if Tacloban was, what could I say, erased from the map.
What are your intervention plan for World Surgical Foundation in Tacloban?
Well, we're trying to raise more money so we can help the healthcare workers, healthcare facilities. And the first thing we're going to do is to donate 2 ambulances and 1 truck, because they need it for immunizations, picking up medications, and then eventually, hopefully, if we could find more funding from donors, we will help them build a hospital. And I'm working with the Department of Health. I had a good session with Dr. Ted Herbosa, who is the Undersecretary of Health.
WSF is partnering with the government, the local governments, in this endeavor.
That's correct. We will partner with the local government, also with the national government.
How about the hospital that you're targeting? It is the provincial hospital?
There's 2 hospitals, 1 provincial and 1 city hospital. And what they need is a roof so they can operate, because now they have generators that can perform surgery and do emergencies.
As the camera goes on continuously for 5 minutes uncut, we see the extent of the devastation in the city center for many kilometers. It has been 1 month since the disaster. It may take a year just to clean up the thousands of metric tons of debris. When residents smell rotting flesh as they walk, they know there are body parts mingled in the debris.